Hello, my name is Michelle Renier, and I'm a MSW full-time student at Waterloo University. I'm delighted to share with you today my love of travel and the many benefits it has brought me over the years. I have traveled to over 30 countries, living abroad in Ireland, Australia, and China, and with each new country came exposure to new cultures, food, and how people live and see the world. As a social worker, I believe that traveling is an excellent way to promote human rights and social justice, support and enhance diversity by addressing structural sources of inequality, and engage in research. In my capstone project, I will discuss these three core competencies through an international social worker lens that I learned during my BSW degree at McGill University and have continued to use in practice and to better understand other perspectives. I'll also share my experiences in China, Egypt, and Cambodia to emphasize my competency in course learning. One perspective that has influenced my thinking and practice during my career and studies has been the international social work lens, because it promotes human rights and social justice and is based on the principles of equality, dignity, and respect for all people, regardless of their race, ethnicity, religion, gender, or social status. The international social work perspective mirrors learnings from the Social Work 600 Health, Equity, and Social Justice, and Social Work 608 Health Issues and Ethics courses. This perspective recognizes the importance of cultural sensitivity and a global understanding of human rights issues. Violations of these basic rights have prompted social work activists around the world to take action, risk their own safety and well-being to fight for the rights of marginalized communities. I was in Cairo during the 2011 revolution, which began on the 25th of January and spread across Egypt. The day was set by various youth groups to coincide with the annual Egyptian police holiday as a statement against increasing police brutality during the last few years of the Mubarak presidency. It consisted of demonstrations, marches, occupations of plazas, nonviolent civil resistance, acts of civil disobedience, and strike. In this social movement, millions of protesters from a range of socioeconomic and religious backgrounds demanded the overthrow of the Egyptian president, with grievances focused on legal and political issues, including police brutality, state of emergency laws, lack of political freedom, civil liberty, freedom of speech, corruption, high unemployment, food price inflation, and low wages. In Cambodia, human rights violations have been rampant throughout history, often resulting in devastating consequences for vulnerable populations. A long history of political upheaval and violence. For example, the Cambodian genocide was an explosion of mass violence lasting for 4 years between 1975 and 1979 and saw nearly 3 million people killed at the hands of the communist political group Khmer Rouge. The genocide resulted in the displacement of millions of people, leaving them without basic resources and subject to constant human rights abuses. Activists and social workers in Cambodia have been working tirelessly to combat these injustices, often at great personal risk. There are ongoing effects of Khmer Rouge that have locals establishing NGOs. One of these women-led organizations made earrings out of used bullet casings to raise money to clean up minefields. As social work professionals, we have a responsibility to recognize and address structural sources of inequity in order to promote diversity and social justice. The international social work community has acknowledged the importance of this work and the impact it has on marginalized communities and strive to make change through local and international policies. In China, the one-party communist system and policies aimed at promoting economic growth have led to a rural-urban divide, income inequality, gender inequality, and discrimination against ethnic minorities. For example, the household registration system is based on a person's place of birth and limits access to public services, including education and healthcare. It also drastically limits social mobility and exacerbates income inequality. In Cambodia, political instability, poverty, discrimination, and historical legacies of violence and human rights abuses have resulted in income inequality, disparities in access to education and healthcare, and limited political power for marginalized groups. My learnings from the Social Work 601 Health Policy course have helped me to better understand how to identify social determinants of health and how to ethically engage in communities to determine needs that will promote sustainable social equity in these countries. Engaging in social work research can provide us with a unique opportunity to broaden our understanding of different cultures and work with diverse groups of people. As I've learned from the Social Work 606 Advanced Social Work Research course, working on cross-cultural research projects is a rewarding experience and requires active understanding and respect for our partners' protocols. We must be aware of cultural differences that can impact research and the interpretation of results. We must also be mindful of any political climate and ensure that we conduct research with caution when dealing with political sensitive topics. Language barriers can be a significant issue when conducting research, and researchers must ensure that all participants understand the research objectives, procedures, and outcomes. They must provide appropriate translation services to ensure that participants have given informed consent and know they can discontinue their participation at any point. Ethical considerations are paramount when conducting research with foreign participants. We must ensure that participants understand the risk and benefits of participating and that their confidentiality and privacy are protected. We must also consider access to data, which can be challenging due to government regulations and cultural norms. Researchers must ensure that they have permission to access data and they understand any restrictions on data sharing and data privacy laws. A collaborative partnership is also essential to ensure that research is conducted effectively and efficiently. We must work together with our international partners to build trust and understanding, share knowledge and expertise, and establish clear lines of communication. During my practicum learning experience at Humber River Hospital, I had the privilege to collaborate with other healthcare professionals, including physicians, nurses, dietitians, physical and occupational therapists, to provide coordinated and effective care. Working on a multicultural health team has been a significant growth experience for me as a social worker. Being exposed to diverse perspectives, values, and beliefs has allowed me to provide more comprehensive and culturally sensitive care to patients. I have learned new practices, techniques, and interventions that have enhanced my professional and personal growth. Through my international social work lens, I witnessed firsthand the critical role of hospital social workers in providing culturally relevant support and advocating for patients and their families. Hospital social work is an essential component of healthcare services in Canada, and it reflects the country's commitment to universal healthcare, where all citizens can access the care and support they need, regardless of their financial, social circumstances, or citizenship status. During my practicum, I was able to employ learning from Social Work 602 Social Work Practice and Health course in my various tasks, including psychosocial assessments, discharge planning, supportive counseling, advocacy, and referrals to community resources. Through my academic and practicum experiences, I understand the importance of cultural competence, holistic care, social justice, and collaboration in social work practice. My work on the different hospital units has taught me the importance of respecting different cultural backgrounds, beliefs, and practices, and providing effective and culturally sensitive care to patients and their families. Along with my work in hospital settings, I'm also seeking out opportunities to work with immigrants and newcomers to Canada. I have experience with this population while working in Montreal and would like to continue in Ontario. From these work settings, I would like to conduct or take part in qualitative, and participatory action research to add to knowledge and learning of the immigrant experience and how social workers can support them in their transition to Canada and in the trauma they've endured before their arrival. Well, that brings me to the end of my capstone presentation. I hope that my experiences have inspired you to explore new countries and cultures, to challenge yourself and build resilience, and to promote human rights and social justice. Thank you for your attention and happy travels.